Have you ever wondered how the big public health decisions get made? You know, the ones that decide where money and effort go to keep us all safe and healthy? Well, it's a story of some really tough choices, invisible calculations that literally shape our lives. We're going to dive into how those critical decisions are made and how we can make them a whole lot smarter.
And here's the fundamental problem, right? We had this endless list of health needs, everything from fighting the next pandemic to boosting mental wellness in schools. But the budget? Yeah, that's not endless. So how do we choose? Who gets the funding? And what gets left on the cutting room floor? That's the billion-dollar question we're tackling. You know, at the heart of this whole debate, you've basically got two competing mindsets. On one side, you have the purists. They're the idealists, right? They want to tackle the root causes of everything, a really broad societal view. But on the other side, you've got the pragmatists. They're focused on what's actually possible, what's achievable within the health budget we have right now. And that constant tug of war between the ideal and the real, it's everything. And that brings us to a huge realization. Trying to avoid making choices, well, that's a choice in itself. When leaders say everything is a priority, they're not avoiding the tough calls. They're just letting those calls happen behind closed doors, based on politics or just, how we've always done it. So, prioritization is going to happen no matter what. The only real question is, are we going to do it out in the open or are we going to let it happen in the shadows? So let's talk about those two paths, right? The open way or the silent way. What does it actually look like when a system chooses one over the other? The difference is just night and day. Explicit prioritization is all about being transparent. It's deliberate. It means people are held accountable for the choices they make. But implicit prioritization, that's the total opposite. It's hidden, it's driven by old habits, it's easily pushed around by politics. One is a conscious strategy, the other is basically flying on autopilot, and that rarely ends well. And here is a perfect real-world example of what that silent prioritization looks like. In Spain, a ton of attention and funding goes into fighting tobacco. Much more than alcohol, even though alcohol causes massive health problems too. So was there a big meeting where they decided this based on evidence? Nope. It just kind of happened. That's a classic case of silent priorities doing the work. And a huge reason this happens is something called inertial budgeting. It's pretty much what it sounds like. It's the tendency to just give a program the same amount of money it got last year, maybe plus a little for inflation. It's easy, it avoids fights, but it also means we almost never stop and ask, hey, is this old program still the best way to spend this money? Now, these decisions also happen on different scales. A narrow framework is when you're making choices inside the health department. Think choosing between a new cancer screening program versus an existing heart disease one. But a wide framework, whoa, that's way more ambitious. That's looking across all of government and asking, to improve health, is this dollar better spent on education or housing or maybe clean air? It's a much bigger, more complex question. Okay, so if we know these choices have to be made, and we know they're super complicated, how can we at least make sure they're fair? Because we might not always agree on the final decision, but we should be able to agree on a fair process for getting there. And this is where a really powerful idea comes in. It's called accountability for reasonableness, or A4R for short. Just think of it like an ethical rule book. It doesn't tell you what to choose, but it gives you a super clear framework for how to choose in a way that's fair, transparent, and builds public trust. And this whole A4R thing is built on four really simple but totally essential conditions. First, publicity. Decisions and the reasons for them have to be public. No secrets. Second, relevance. The reasons have to make sense to normal people based on evidence and values we all share. Third, appeals. You need a way to challenge a decision if you think it's wrong. And finally, regulation. You gotta have some kind of enforcement to make sure the other three rules are actually being followed. Okay, so we've got the ethical framework, but what are the actual practical tools that officials can pull out of the toolbox to make these gut-wrenching calls? One of the big ones is called Program Budgeting and Marginal Analysis, or PBMA. I know, it sounds super technical, but its goal is incredibly simple. Get the most health bang for every single buck we spend. It's just a systematic way to figure out where our money can do the most good. And here's the most powerful and, let's be honest, the most controversial part of it: disinvestment. This isn't just about finding new things to fund. It's about having the guts to look at programs that aren't working well and actually cutting their funding to move it somewhere better. It is the hardest step, but it's absolutely the most important one. But what if, maximizing health gains isn't the only thing we care about? What about fairness or equity? Well, that's where another tool comes in, multi-criteria decision analysis, or MCDA. This lets leaders officially bake in other important values, like equity, or political feasibility, or just what the public actually wants, right alongside the cost-effectiveness data. So here's the bottom line difference. PBMA is laser-focused on one question. How do we get the most health for a dollar? It's all about efficiency. But MCDA asks a much broader question. Based on all the different things we care about as a society, what's the best overall choice? It lets you make a more nuanced call, one that might favor a program for a disadvantaged community, even if it costs a bit more. All right, so theory is one thing, but what happens when these fancy tools and frameworks meet the messy reality of politics, budgets, and actual people? Let's look at a couple of real-world cases. Let's start with a big win from Calgary, Canada. The health authorities there decided to use that PBMA process. And the reason it worked so well came down to two things. They had leaders who were genuinely all in, and they brought everybody to the table: doctors, nurses, and community members. So what was the result? They successfully moved 3% of their total budget away from stuff that wasn't working and into programs that were. Now, I know what you're thinking. 3%? That doesn't sound like much. But in a health system worth billions, that's tens of millions of dollars. That's real money moved into critical areas like addiction services and mental health. That is a huge win. Now for the flip side. Let's look at that cautionary tale from Spain again. They developed these big national health plans, but they did it without any real explicit prioritization. They tried to make everybody happy, which meant nothing was a real priority. And the result was exactly what you'd expect. The plans became, and I'm quoting here, unrealistic wish lists disconnected from budgets. I mean, they looked great on paper, full of amazing goals, but because no hard choices about money were ever made, they didn't really change anything in the real world. So when you look at the places around the world that actually pull this off, what's the secret sauce? Well, it pretty much boils down to this. You have to involve everyone, you have to be transparent, you need a way for people to appeal decisions, and, this is the big one, you have to actually move the money. If you don't do that last step, the whole thing is just a thought experiment. But let's be honest, this stuff is incredibly hard. If it were easy, everyone would do it. You're fighting against our own human brains, which hate change. You're fighting against turf wars inside big institutions. And you're fighting against powerful corporate interests. These are the real human barriers that make rational decision-making so tough. I want to leave you with this one analogy because I think it says it all. A health plan that tries to include everything is like a big family photo where you keep zooming out and out just to make sure you get every single cousin in the shot. By the end, you're so far away you can't really see anyone's face clearly. Real prioritization is about choosing what to focus on. It's about making those tough, explicit choices, because that is the only way we're ever going to truly make a difference.